And we're back to viewers with our second guest. So everyone cares about their appearance and their body health, and we all strive to reach our ideal weight and feel comfortable with ourselves. Today, dear viewers, we have Dr. Khaleel Ibrahim, a general and bariatric surgery senior specialist, to talk about the causes of obesity, its complications, and the medical and surgical options available to manage weight safely and effectively. We'll also explore how combining proper nutrition and exercise can help achieve the best results and maintain a healthy lifestyle. So dear viewers, let's all welcome Dr. Khaleel. Welcome, Dr. Khaleel, to Good Morning Kuwait. It's a pleasure to have you.
Good morning, Kuwait, and thank you so much for having me today. Thank you.
It's a pleasure to have you, Doctor. And this subject, it's such a relatable thing here in Kuwait these days. We'd love to know all about obesity and its causes, please.
Absolutely. Well, you know, obesity has been on the rise. Within the last 20, 30 years, we saw a tremendous increase in body weight and obesity itself. You know, many causes, okay, but mostly related to the way our lifestyle changed and the way, you know, food is becoming easier to get, more abundant, and exercise has been less right now. So those are the two main factors we face in controlling obesity within our population.
So, yeah. Doctor, we're only talking here about in Kuwait, and I'm sure everybody here in Kuwait is going to junk food. Maybe that's the main reason, I think, for obesity mostly. And as you said, healthy lifestyle definitely impacts that. We'd love to know that are there differences in weight gains for men and women?
So in general, men and women share equal rates of obesity. It's mostly due to, you know, genetic factors that play a role. So families that come with, you know, obesity background are more likely. I would less attribute it to being a man or woman, and more likely to be what your lifestyle is, what your food is like, what genetic factors you have, and whether you know, do exercise or not.
All right. So, Doctor, I'm sure you've seen these people that can eat 10 plates and not gain any weight.
Yep.
And you said there is a factor of genetics. How is this related?
So these are, you know, these people, if we want to, it's very interesting. How can someone eat such huge proportions, okay, or portions, and not gain weight? In reality, these are the minority people. Usually they have, you know, less genetic predisposition to gain weight. And we're only really seeing one side of the story. We're only seeing the competition where they can eat. We're not seeing what they're doing the rest of the week. Yes. Are they training? Are they working out? Do they have the genetic predisposition or not? But in general, people that can, you know, that eat large amounts, okay, frequently, will ultimately gain weight unless they burn it or do something with it.
Yes, so talking about our modern lifestyle now, what would you say about the modern lifestyle and the people gaining obesity?
So we saw a tremendous shift in the way we eat, and you know, how we eat and the quality of food. Even if you go back, you know, 20 or 30 years ago, it's not the same type of food. Right now, we rely on highly processed food. We rely a lot of you know, fast food that is really high in calories. The food is easier to get. Yes. And more readily available. You can order at 1 or 2 a.m., okay, and you can order whatever.
That's the best time, Doctor.
I know, I know it's but the problem is, okay, we don't move as much either. And we consume way more calories than what we need. And that's the main reason. That shift in lifestyle is what's creating this disease, as I would say.
All right. I'm sure it is a disease. Obesity is really bad. We'd love to know the complications that come with this disease, Doctor.
Okay. So when we talk about obesity, obesity is a gateway to many, many, many different, hundreds of diseases. So as the weight increases, the chance of diseases increase. So we're talking about high blood sugar, diabetes. We're talking about high blood pressure, problems with breathing, problems with your heart, with your cholesterol. And those will lead ultimately to damage in your different organ systems. Your heart will get affected, your brain will get affected, your eyesight. Yes. So if we treat obesity, we can possibly prevent a lot of these complications from happening in the future.
Yes, you know, Doctor, these days I know a lot of friends, they're trying to eat everything available because these injectables are available also in the market.
Yep.
Is it like, can we do this or reduce obesity just through diet alone?
So diet and exercise plays a vital role in treating and controlling, you know, weight. But at the same time, It depends on what the level of obesity is. If you're talking about, 10 kilos, the treatment is very different to a person coming in with 30 or 40
Yes.
kilos of excess weight. So medications were developed to help decrease the amount of food we eat, play a little bit with your metabolism, and ultimately, treat the obesity. They're very effective for the right person, and of course, after evaluating and consulting with the specialist involved.
Yes, definitely. And dear viewers, if you're going through these obesity injectables to lose weight, I'm sure after you finish the injectables, you need to really maintain the diet you were taking before injecting or during the injectables. Is that correct?
Absolutely. So one of the challenges we face currently is the weight regain after stopping the injectable medications. And it's very tough, okay, if you want to control your weight while you return back to the old habits. So number one, you have to get rid of the old habits that led to the obesity. Number two, we have to be more active. We have to, train and utilize exercise in order to keep our weight well controlled.
Yes, definitely, doctor. Dear viewers, you should really take care of your health in these modern days. You want to have a healthy lifestyle to enjoy all the blessed that we have here in Kuwait. Doctor, obesity and surgery, what do you think?
Okay, so part of my specialty is, weight loss surgery.
Yes.
We realize that treating obesity is not as simple as what we thought. Okay, just diet and exercise it's possible, but it's very difficult to get rid of massive weight like 30, 40, 50 kilos. So that's where, weight loss surgeries were developed, and they are a very effective way in treating excess weight and treating the associated complications. We are seeing improvement or resolution of a lot of the diseases associated with obesity.
Yes.
And that's where they play a critical role with well-selected patients.
All right, so you need to really select the patient
Absolutely.
in order to have a successful surgery.
Absolutely, absolutely. It's not for everyone, but it's an excellent choice for the proper patient.
So Dr. Khaleel, who would you recommend somebody that's facing obesity to come and do the surgery?
In general, we look at the patient as a whole. We look at, the patient's age, their weight, have they tried any different weight loss treatments in the past, what medical problems they have. And generally, one of the classifications we use is a body mass index, where we take their weight and their height and calculate a number. Those who have a lot of excess weight, to make it easy for viewers, let's say 30, 40, 50 kilos, and especially if they have medical problems associated with, those patients are the best candidates to undergo weight loss surgery and benefit from the weight loss surgery itself.
All right, so doctor, since you are segmenting these patients to come to the clinic and do the bariatric surgery, when they get approved, what are the special steps taken before the surgery?
There is a process, okay, starting from initially evaluating the patient, and then of course we do blood work, we do endoscopy to check their stomach. We make sure that they, they modify their habits in order to increase the rate of success after surgery. We make sure that they're optimized for surgery. If they're smokers, quit smoking. If they don't exercise, maybe do a little bit of exercise. And after they complete all the pathway, then they can undergo surgery.
All right, dear viewers, please make a medical checkup before you go to any surgical operations, especially in obesity. So doctor, when these patients come to you and after doing the surgery, how do you advise them post-surgical activities, for example?
So number one, definitely follow up with your surgeon, okay? Just to check that the weight loss is fine, you're taking your supplements, that everything is in check. Later on, we have to maintain a healthy lifestyle through diet and through exercise. The benefits of exercise are tremendous. They help maintain muscle mass, they help strengthen the body, and then they also help prevent weight regain years later. So it's all about, resetting everything and developing healthy habits.
Yes, definitely, dear viewers, you have to have healthy habits, as Dr. Khaleel Ibrahim here said, and not to return to the obesity state.
Nope.
So the causes, doctor, of obesity or after treating it, how can it come back so fast?
Okay, so you're genetically predisposed to the weight gain. So after we treat it, we treat a lot of factors, okay, that help with the weight gain. But unfortunately, if patients go back to their old habits,
Yes.
snacking, eating unhealthy food, they can, pack so many calories that will help regain the weight. Usually after, weight loss surgery, it doesn't happen immediately.
Yes.
It usually happens 5, 6, 7 years later. But ultimately, weight will find its way unless you actually control these factors that play a role in the extra calories and extra, predisposition to the weight regain.
Yes, definitely, doctor. These patients should really take care of themselves. If they are willing to go to take a surgery, I'm sure they're willing to continue the rest of their life healthy.
Absolutely.
So, doctor, we'd love to hear a simple advice from you for our viewers in making, for example, a simple workout throughout a week or a special diet that needs to be maintained.
Okay. Number one, let's rely on improving our diet. The more we know about diet, the better the chance of controlling our weight. So diet education is very important. Read as much as you can. Okay, understand what carbs and what fats means and how much protein I need. That's definitely the cornerstone. Number two, let's start by eating less from outside and eating more at home. Generally speaking, that will help, control how much calories, because, ordering outside has its consequences ultimately.
Yes.
The second thing is definitely incorporate a healthy lifestyle through exercising. You need to work out. Okay, I'm not talking 7 days a week. At least start with walking. If you can go to the gym, that's even better. At least go 4 to 5 times a week, okay? And that would help minimize the chance of you gaining weight.
Yes, doctor, and you mentioned people should eat inside their home and not outside. And people, I know mostly people here don't like to cook. There's a lot of, alhamdulillah, in Kuwait here, we have a lot of healthy restaurants that can provide a program for these people.
Yeah.
How do you see the relationship or cooperation between these restaurants that are providing healthy diets and to those people who are trying to lose obesity?
They're definitely a good start, okay? I mean, having restaurants which provide healthy food is definitely a bonus. Now, the thing is, it depends whether I'm trying to maintain my weight or lose weight, okay? Yes. What's important is to realize patients who have a lot of extra weight, we're talking, the morbidly obese we call, these diets are good, beneficial, but they're less likely to make you lose, the 20, 30, 40 kilos that you're trying to lose. So that's one of the limitations of the diet center. So they're good. They're good for people who already, have a little bit of extra weight to lose, want to maintain the weight, but they're less effective to patients with morbid obesity. That's an important thing to understand.
Doctor, I think these restaurants are here for people that can't cook like me.
Okay. That's
All right. So Dr. Khaleel, would love to hear golden advice for you, from you to our dear viewers who are obese and they would like to take this surgery.
Okay. So don't take obesity lightly, okay? It is a tough medical problem to treat because there are so many factors playing a role in how your body reacts to the weight. So what I would say, there are definitely a lot of doctors that are available and specialized in treating obesity. So definitely seek a medical advice, seek their attention. They can lead you to a healthy and a medically qualified way in order to lose weight, okay? Don't just let it go there, okay, because it's not going to disappear by itself.
All right, dear viewers, please listen to the advice of Dr. Khaleel. And Dr. Khaleel, my last question for you is people who undergo obesity surgery. I'm sure you've seen a lot of loose skin. Do you recommend them going and taking a plastic surgery afterwards, or what's the deal?
Sometimes, with especially massive weight gain, your skin stretches.
Yes.
So even after weight loss, we end up with a lot of loose skin. Now, if it's a little bit of loose skin, then probably there is no need. But sometimes when you lose massive amount of weight, ultimately loose skin is going to be there, and sometimes it affects how patients live their daily life with it. So definitely, if it's affecting the person, get the plastic surgeon to evaluate you and get that skin off.
All right, Doctor, thank you so much for joining us here on Good Morning Kuwait and sharing all your experiences and insights for our lovely dear viewers.
Thank you so much for having me, and it's such a pleasure. Thank you.
The pleasure is ours, Doctor. So, dear viewers, we'd all like to thank Dr. Khaleel Ibrahim, a general and bariatric surgery senior specialist here in our beautiful state of Kuwait. Thank you so much.
Thank you.
So, dear viewers, now we shall take a quick break and we'll be right back.